Mm-hmm. I'm really sorry to hear that. So could you just tell me more about this?
Yeah, of course, it started 5 days ago and it's getting worse day by day.
Mm-hmm. I'm really sorry to hear that. So, do you have any other lump in your body or just this one?
No, just this one.
Mm-hmm. So, you noticed it just 5 days ago.
Yes, as I said,
Okay. So, is there is any increase in the size or is it static?
yes, of course, it's getting worse and being bigger over the last 2 days.
Uh-huh. I see. I'm really sorry to hear that. So, do you feel any fever?
Fever,
Mm.
yes, sometimes, yeah.
Okay.
But
So, yeah.
but it's not the main issue. Just the main
Mm-hmm.
issue is this lump in my left thigh.
Okay. So, is there any discharging from this lump?
Discharge, no.
Mm,
Just a
okay.
little bit of blood.
Uh-huh, I see. So, do you feel any pain?
Right now, yes.
Oh, I'm really sorry to hear that, Mr. Lee. Would you want for me to prescribe for you analgesia or painkiller?
Yes, that would be very nice.
Okay, I will ask my nurse to bring it for you now. So, could you just scale this pain for me from 1 to 10 as 1 is the lowest and 10 is the highest, please?
It could be 7.
Uh-huh. Okay. So, yes, I would like to ask you further question, Mr. Lee. So, do you inject yourself any drug?
Yeah, of course. I used to inject myself every day, but the
Uh-huh.
last one in the 5 days ago, it hurt
Mm-hmm.
me and this swelling, it start appear.
Uh-huh. Okay. So, do you think, Mr. Lee, this lump is moving up and down like we can say, is it pulsatile?
Yes, it's
Uh-huh.
versatile.
Okay. So, do you witnessing any unexplained weight loss recently?
No,
What about night sweating?
no, I didn't experience that.
Okay. What about your appetite?
My appetite is good.
Okay. So, Mr. Lee, this lump, is it like when you are lying down, is it disappearing? And when you are standing up, it's become more prominent? Do you
No,
witnessing something like that?
no.
Oh. Mm-hmm.
But
So,
doctor, why
yeah.
you ask me this couple of questions?
Yeah, just we need to exclude some medical condition, Mr. Lee. I will explain it in detail. But I would like to know if you have any tummy pain, Mr. Lee.
No, have no any tummy
Uh-huh.
pain.
Okay, thank you for cooperation, Mr. Lee. So, do you have any surgical operation before?
No.
Okay. Do you have any chronic medical condition?
Yes, I was diagnosed by hypertension and
Mm-hmm.
diabetes 10 years ago, and I am on amlodipine, I think something called like
Mm-hmm.
this. And for diabetes, I'm
Mm-hmm.
not sure what I take for it.
Okay, no problem. You are taking injection or just tablets for diabetes?
Yeah, firstly, tablet, then my GB converted to the an injection drug.
Mm-hmm. Okay, so we will dive in detail for with this in just simple minute. But I would like to know, Mr. Lee, do you have any allergy to any type of medication?
Yes, I am allergic to
Mm-hmm.
penicillin.
Okay, okay, so that's good to know. Do you have any family history of or similar condition, Mr. Lee?
I'm not aware by anyone, doctor.
Okay, no problem, no worry. So, could I ask you some personal question, Mr. Lee?
Yeah, of course.
Okay, what do you do for work?
I am a carpenter.
Mm-hmm. Okay, so, and who you are living with?
I live with my wife and youngest daughter.
Mm-hmm. So, do you smoke, Mr. Lee?
Yes, I'm a heavy smoker.
Mm-hmm. Could you tell me how many packs per day you are smoking?
2 bag per day for 20 years.
Mm-hmm. And what about alcohol?
Uh, I drink 16 units per week.
Uh-huh. So, before we proceed further, Mr. Lee, just I would like to know, what do you think the cause of your symptom?
Doctor, to be honest, I'm not, I didn't know. I'm not aware about what's going on. Can you help me?
Yeah, all the medical team here will try to do their best to help you. So, and what is your main concern here, Mr. Lee?
This bed.
I'm really sorry to hear that. So, and what are you expecting from us to do for you, Mr. Lee?
To figure out the cause and, of course, help me and give me some medication. Time up. Could you please present your case?
Yes, I took a history from Mr. Lee, 45 years old male. He came complain of left growing swelling, which is appeared 5 days ago and pulsatile in nature, associated with pain, with no fever. Mr. Lee is non-hypertensive and diabetic. Also, he's non-allergic to penicillin. Uh, my main diagnosis could be
Mm-hmm.
infected pseudoaneurysm, as he admit he's having a fever in addition to pain and a
In which
history of
in which side? You said infective pseudoaneurysm. In which side, please?
in the growing area.
Yeah. So what other differential diagnosis you will consider?
Yeah, I should consider a growing abscess
Mm.
and an infected inguinal lymphadenopathy. Also, we should exclude inguinal hernia and femoral hernia.
So can you tell me how to approach this patient?
Okay, I will start to do full abdominal examination. After that, I can go for a test, blood test. It can be full blood count and uh, renal function test, CRB, sorry, for the infection. And I will request for abdominal sonography, sonography for the abdomen and for the groin.
Okay, and what about the treatment exactly?
Okay, so treatment it can depend on his complete assessment, but we have operative and non-operative. Okay,
Mm-hmm.
operative we can do a surgical ligation of the femoral artery, and non-operative can be conservative, antibiotic addition and follow-up.
Okay. Can you define what is a true aneurysm and pseudoaneurysm?
Yeah, true aneurysm is the three layers of the vessels dilated more than 1.5.
Okay, and what about pseudoaneurysm?
Pseudoaneurysm is rupture in the anterior layer of the inner layer of the vessels, which cause extravasation of the blood to the outer connective tissue.
Between which layers, please?
Tunica media and adventitia.
Yeah. This is the last question in this session. Very nice presentation, As-Sadiq. Yes. So let us review from the beginning. The time remained, you have 10 seconds. Okay,
Mm,
perfect. So, Sadiq, very nice presentation. Excellent. Just let us review from the beginning. You start by introducing yourself. Hello, my name is Sadiq. I'm one of the surgical doctor. But you say they have been asked. We
mm,
encourage guys to say, I am one of the surgical doctor. I will be your doctor today, and I would like to ask you a few questions regarding your condition. Not I have been asked. Okay.
okay.
Yeah. You started by an open question, which will increase the mark of professionalism. Could you tell me more about it? Very nice. And then you asked about the differential diagnosis. Sadiq, you know, the four mark for professionalism. So you should start to
Mm,
exclude your main differential diagnosis first, then other differential diagnosis. You start by excluding the abscess first. So,
mm,
so train yourself to exclude the main differential diagnosis first. From the scenario outside the exam room, you will know this station is for what. It is infective femoral pseudoaneurysm or abscess. So start
mm,
to exclude your main differential diagnosis first to get high mark in professionalism. I'm so happy that you asked all the question about the infective femoral pseudoaneurysm, the pain, and the pulsatility, and the color changes in your legs. Perfect. And also very nice that you offer me a painkiller. Just a little bit change your tone, Sadiq. When I say they have pain, you should say, I am really sorry, Mr. Lee. Okay?
Mm-hmm.
And also increase the time that you mention your patient name. Make it couple of times. Okay?
Okay.
You exclude the groin abscess, the neoplastic, and the inguinal hernia perfect. But time didn't allow you to exclude the systemic review or to ask about the systemic review, but it will not affect your mark, obviously.
Mm-hmm.
Regarding the presentation, Sadiq,
Mm.
you said, I think I present, but we train the guys to say I took a clinical history. Train yourself to say I took a clinical history from Mr. Leah, 45 years old, blah blah blah. You mentioned the presentation perfectly. You mentioned the main compliant. You give 2 to 3 points about the main analysis of the compliant, and you support it by 3 or 4 signs to your main differential diagnosis. But Sadiq, don't let the examiner
Mm.
ask you what's your main differential diagnosis. When you start to present your case, say at the end, so my main differential diagnosis is infective femoral pseudaneurysm. Also, I would like to consider. Don't let the examiner ask you again, what's your other differential diagnosis? It will last you 10 seconds or 20 seconds. Okay.
Okay.
Uh, Regarding the how to approach the patient, I'm so happy that you classified your answer into blood investigation and imaging. This also it will increase the mark of professionalism. And yes, regarding the treatment exactly, you mentioned it non-operatively and operatively, nice, but you mentioned operative before non-operative.
Mm.
So start by non-operative management, which is analgesia antibiotic, and discuss the microbiology, and then go to the operative management. Otherwise, I have no any
Okay.
point to add. Nice presentation. Sorry.
Okay. Thank you.
Okay, so should we go to the next session with Ammar? I think.
Okay,
Okay, Ammar, are you ready?
ان شاء الله.
Okay. Okay, Ammar, your station is a seizure.
Yes.
Let me read the scenario. A 29-year-old man with non-epilepsy presents after experiencing a seizure today. Okay, you are the surgical SHO and you have 6 minutes to take a focused history and 3 minutes for discussion. All right.
Okay. Okay.
So let me put the timer, please.
Okay.
6 minutes started.
Good morning. I'm Dr. Ammar. I'm the surgical doctor in charge here today. May I confirm your name and age, please?
Good morning, doctor. I am Susan and I am 29 years old.
Nice to meet you, Miss Suzanne. Miss Suzanne, today I would like to ask you some questions related to your condition. Is that okay with you?
Yeah, that's fine, doctor.
Okay. Miss Suzanne, would you please tell me what brought you here today?
Yeah, doctor. I'm really worried about that I
Hmm?
experienced. I had abnormal movement in my arm.
I'm really sorry for that, Miss Suzanne. Miss Suzanne, would you please tell me more about this?
It happened at home while I was watching the TV and my arms started shaking and I fell.
Hmm. Okay. And when it happened?
Uh, when I was watching the TV,
Okay. Miss Sudan, do you feel anything before the episode start?
yes, I felt dizzy and lightheaded before it started.
Mm-hmm. I'm really sorry for that, Miss Sudan. That must be frustrating.
Yeah,
Do you smell any unpleasant
no,
smell?
no,
Do you hear any abnormal sounds?
no, no.
Is there anyone witness this event, Miss Suzanne?
Yes, my husband.
Okay. And how he described
Yeah.
the event
He
for you?
said I felt suddenly shocked all over and then lay still.
That must be very hard, Miss Suzanne. Miss
Yeah,
Suzanne,
doctor.
did you hit your head when you fall?
No, but I lost my conscious 2 to 3 seconds, or 10 seconds.
Okay. Does your whole body shake or only just
No,
part of it?
no, part of it. And I said my both arms.
Mm-hmm. Did you soil yourself?
Yes.
And did you bite your tongue?
No.
Okay, Miss Suzanne. Miss Suzanne, after the event is finished, how did you feel exactly?
I felt very tired and confused for a while, doctor.
Really sorry for that, Miss Suzanne. And when you regained your consciousness?
I think, as I said, 10 seconds or 20 seconds. Can you help me, doctor? I didn't know what's going on.
We'll do our best to help you, Miss Suzanne. I'm
Yeah,
here
I
to
hope
lend
that.
you a hand.
Yeah, I hope
Yeah,
that.
we are here to support you and treat you, Miss Suzanne.
Okay, thank you.
Okay, Miss Suzanne, did you notice that your head or eye deviated toward one side?
No,
And did you experience lip smacking
no,
or excessive eye blinking?
no.
Miss Suzanne, do you have any previous episodes like this in the past?
Yes, doctor. As I said,
Hmm?
I was diagnosed by epilepsy 10 years ago, and the last episode,
Mm-hmm.
it's
Mm-hmm.
about 5 months ago.
Mm-hmm.
But this is a different. The only my both hands are shaking.
Okay. Miss Suzanne, and how frequent do you experience this?
Uh, you can say three time
Hmm?
or two, 3 time per month.
3 times per month.
Yes.
And if I ask you how many times per week?
As as I said, I was diagnosed. Please mute yourself, Fatima Al-Zahra. As I said, it started 10 years ago as I was diagnosed by this epilepsy.
Okay. Miss Suzanne, did it come in the daytime or night time?
I'm not aware by this.
I'm talking about your previous episodes.
Yeah, sometimes at
You
the morning, sometimes at the night.
Okay. Miss Suzanne, is it associated with any special event like sleep disturbance,
No,
uh, drinking alcohol,
no,
or any drugs?
no.
Miss Suzanne, before we go any further, I would like to ask you some questions to clarify my diagnosis. Is that okay with you?
Yeah, you already take the consent, doctor. Why you take again?
Okay, sorry for that, Miss Suzanne. Do you
Yeah,
experience
go on.
leg weakness?
Weakness in my legs? Yes.
Yes,
Yeah.
really sorry for that. And do you experience leg numbness?
No, just weakness.
Okay. Do you have headaches?
Sometimes.
Mm. And do you have nausea or vomiting?
No, but my appetite is very poor, doctor.
Mm. That must be frustrating, Miss Suzanne.
Yeah.
And do you experience any weight loss
Yes,
unintentionally?
doctor. Yeah, yeah.
How
I
many
have
kilos?
lost 6 kilograms
Over how long?
for last 2 months. Can you please present your case time up?
Okay. Today I'm presenting Miss Suzanne. He come today with experiencing jerking on both arms. Experienced these episodes at home when he watched TV. He lost consciousness, and he also had a previous history of epilepsy 10 years ago. And the last episode was 5 months ago. Also, she didn't have an post-ictal manifestation except for drowsiness and confusion. So she lost 6 kilo, kilogram over the 2 months. So my main differential diagnosis would be brain tumor. I should
What,
also consider epilepsy,
what else?
metabolic causes, dyskinesia, and myoclonus.
Okay. Can you tell me what red flag did you identify?
In this case,
Yes.
uh, sorry, you skip this question till the end of the
Okay,
conversation?
of course, of course. What investigation would you arrange for this patient?
I would like to firstly start by blood investigations like AB, CBC, arterial blood gas, and also blood glucose. Also, I will order urea and electrolyte and magnesium, calcium, prolactin.
Okay.
Also, I will consider imaging, CT head because I suspect tumor. Also, electroencephalogram and MRI brain.
And what about the treatment
Okay.
or the immediate
The
management
treatment,
if your patient have a seizure?
yeah, if the patient has a seizure, firstly, I will ensure a safe place and I will try to put the patient on the lateral position or recovery position if it's possible. Also, I will do close monitoring and management for the patient.
Okay. And the ongoing management of after the seizure.
Okay, the ongoing management, firstly, I will start by ABC and I will monitor the oxygen saturation. Then I will consider benzodiazepines to stop or to prevent uh, further seizuring. Also, I will start anticonvulsant therapy.
Okay. Can you mention another anti-epileptic medication?
Yeah, I start by phenytoin, 300. The loading dose is
Time up, but
1,000
continue.
milligram.
But continue.
Okay.
Mm-hmm.
And the maintenance 300 to 600 milligram TDS. Also, we have phenobarbital, 60 milligram to 20 milligram per oral, and also valboric acid, 15 to 60 milligram per oral TDS or BD.
Okay.
Also, I can give reduction carbamazepine.
Yeah. And what is the definitive treatment for your patient at your main differential diagnosis?
Yeah, I will do stereostatic therapy and debulking for the tumor.
After discuss the case in the MDT meeting. Okay.
Yeah,
Okay. This is the last
good.
question in this session. Very nice presentation, Ammar. Let us
Thank
review
you.
from the beginning. Ammar, I'm very happy that you said, and one of the surgical doctor, I would like to ask you, not I have been asked.
Yeah,
Uh, okay. And you start to ask, you take a lot of time, Ammar, asking about the preectal, anectal, and postectal, so that you didn't
yes,
differentiate or exclude other differential diagnosis. So
yes.
Ammar, in
Right.
the seizure is one of the most difficult station in the whole MRCS B history sessions, but you have
Yeah.
some question to ask. In the preectal, you should ask about any visual hallucination or auditory hallucination or abnormal smells. These three
Yes.
questions only. In the ectal, you
Okay.
should ask about if he fell, if he lost his consciousness, wet on himself, and bite his tongue. These four questions only. And the postectal, is there any change you noticed after this episode, Mr. Jack or Mr. Lee? Like numbness or weakness? Just like that. Then go
Okay.
immediately to differentiate your differential diagnosis or to exclude your main differential diagnosis, which is the brain tumor. I'm so happy that the time allow you to exclude the brain tumor by asking about the weight and the appetite.
I have to go for the differential before asking about the previous episodes.
Yeah, previous episode, you can ask it about in the analysis of the main complaint.
Okay.
Did you
And
experience
what
this
about,
episode before? Yeah. Or in the past medical history.
okay. And what
But
about the eyes?
the what? The eyes?
Eyes. Yeah.
Yeah, eyes after differential diagnosis, of course. And the
Okay.
past medical history and drug history and social history. Then you should
Yeah.
ask about the patient about his concern. So time didn't allow you to exclude the meningitis and the
Yes.
trauma and metabolic. And also
Perfect.
in the social history, you should ask about alcohol,
Yeah.
but train yourself to hurry up. Don't
Yeah.
take a lot of time
Okay.
asking about the ectal and postictal and preectal. Regarding the
Yes.
presentation, very nice. But as your patient has epilepsy, you should say, I took a clinical history from Miss Susanna, long case of epilepsy, present with a blah, 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 until the end.
Uh,
You manage it
okay.
well, but if you say this will be perfect,
Okay.
uh, I'm so happy that you mentioned the main diagnosis and the other differential diagnosis immediately. Regarding the red flags, you said skip these questions and back it later
Yeah.
again. Nice. The weight loss, the increased frequency of seizure, and the postictal confusion.
Yeah. Yeah. Yeah.
Yeah. Regarding the investigation, when I ask you, Ammar, what's your investigation? You should not jump immediately to the blood investigation and imaging. You should say, I will start by doing full neurological examination. Yes.
Yes. Right.
Then I will request blood investigation, imaging. Make your classification very clear to the examiner. So can you create the
Okay.
mark of professionalism, blood, and imaging, as you mentioned.
Okay.
Regarding the treatment,
Perfect.
the immediate management, very nice. You mentioned all the steps in the treatment and the doses of the medication. I have no any other point to add. Very nice presentation, Ammar.
Thank you, Mister.
Okay.
Thank you. Appreciate it.